It seems pretty easy, but as you know, go ahead and follow along with me, okay? You'll notice that obviously this is a practice, so it totals up to 100 questions. So with a 1 point value, right? So each question equals a point. I'll go through the questions. If you notice, first section right here, you'll see anatomy and physiology. This percentage right here, which is 17%, is basically what is expected on the MBLEX. You'll see 17% of the material based on just anatomy and physiology. As we go through the whole series of questions, you'll notice like that's just A&P, like pathology, for example. You'll see 9%. There's still important questions to know and understand, but I'm going to try and help you kind of decipher the question just so you know, all right, do I really know what the question is asking me? One, and then do I really know the answer, right? So for example, health and hygiene, universal precautions, that's 17% of the material in the MLEX. And like hydrotherapy, 4%. So as we go on through all of the questions, just keep that in mind. A&P, it's amazing. Like laws and rules have a very short, minimal. You would think they'd be more, right? Because anything legal should be I think explained more in detail, but it's not. So you're gonna just pay attention to the subject and then the percentage. Okay. Let's see. So I'm gonna give you a couple of seconds. We're gonna go over like question one is, what is the cell's control center that directs most metabolic activities called? I'll give you a few seconds. Let me know your thoughts. If you know the answer, let me know. So is it the mitochondrion, nucleus, nucleolus, mitochondria?
That one would be the mitochondria.
Okay. What else? Who else says something else
I was
or agrees?
gonna say nucleus because I figured just because it's the center.
Okay, so Yamada says nucleus. Maudi, you say the mitochondria?
Yes.
Okay. Why do you think it's the mitochondria?
Well, to my understanding, it's the power cell.
Okay. So the correct answer is nucleus.
Nucleus. Oh.
Mhm. So it's asking, what is the cell's control center, right? Who is the person in charge? So you can't have a cell without its main motherboard, and that's the nucleus. That's what controls everything. Mhm. So think of it as the brain, the nervous system of the cell. Okay, it's what directs messages, it's what gives orders. So the control center in any metabolic activity. Now, the mitochondria, yes, is important. However, it's more directed towards energy.
There you go. Yeah.
So, right. So the mitochondria, you need energy to be able to do things, but the nucleus is what gives the order.
Mm-hmm.
Okay. Any question?
No, I'm getting.
Does that make sense?
Yes.
Okay.
You mentioned that it was that to produce the ATP, and that's where like.
Yeah. So mitochondria is responsible for creating ATP, and without the ATP, we have no energy in the cells.
Mm-hmm.
Okay. All right. So question 2. What is the tissue that covers external and internal structures that lines up? That and lines open and closed body cavities called? What is the tissue that covers external and internal structures and lines open and closed body cavities called? Is it connective tissue, muscular tissue, nervous tissue, epithelial tissue? Yamada?
I am between two, so I'm just gonna say connective tissue,
And what is the other one?
muscular tissue.
Okay. Audi?
I don't know. I'm between connective and epithelial. Um,
Connective and epithelial. Okay. Yamada, why do you say connective and muscular?
Muscular because it's saying the body cavities.
Okay.
So I'm figuring organs and stuff, so I don't must. And then epithelial, I think of isn't that skin? So I figured just connective tissue would be the other one.
So okay, so now let's eliminate 50% of the answer choices. So you're gonna go with connective tissue, Yamada, and Maudi, you're gonna go with what?
I'll go with epithelial tissue.
Epithelial tissue. Okay. Here we go. The correct answer is epithelial tissue. So, what is the tissue? Let's break down the question. What is the tissue that covers external structures? Yamada, you said it earlier, like with the skin. Skin is made up of epithelial tissue, but internal structures such as the lining of your intestinal wall, what is with inside the body cavities, that's all made of epithelial tissue. Muscular tissue is only going to be found in muscles.
And
There's
muscles.
no other area you're going to find um, muscular tissue. Obviously, nervous tissue, there's no other tissue you're going to find nervous tissue other than the nerve cells. Connective tissue, yes, I could see where you're coming from, but that's more fascial. More fascial.
Isn't that
More
when it also to the organs, like to
yeah, but it's what covers it.
Mhm.
It's asking what is the tissue that covers external. So right off the bat, you're thinking, Yamada, especially having to deal with skin. Where else are we going to find skin in the body, right? Externally. And so if we think of like the internal structures of like our intestine, right, or our organs, that's made of epithelial tissue. Okay, so that's where it's asking. So think as far as I like to do that when I ask or look at a question, read it. Okay, what is exactly is it asking me, and then break it down immediately to 50-50 question answer choice. And then, okay, one person said connective tissue, the other one said epithelial. So that's where you're gonna start applying. Do we have connective tissue externally? What do you think? No, right?
Right.
We won't find connective tissue externally, but we'll find epithelial externally. So
Okay.
that's kind of how you can kind of see and break things down and ask yourself, okay, how do I start eliminating? It's a process of elimination.
Yeah, that makes sense. Because I mean, if I would have just focused on the fact that it says external, the only one that would have made sense would be epithelial cells because it's on the skin.
Yeah. But because it's asking both external and internal, we do have epithelial internally as well. So I think the dead giveaway in this question alone is the fact that it even asks external. That should be the giveaway right there. Okay. So remember in Kines how we were going over like how the heck do we remember the names and structures of certain things? Most of the time the answer is within the name, right? Like the scapula, right? Or understanding what name involves what movement, right? We know if it's gonna raise the scapula, it's gonna be the levator scapula, right? It kind of, you have to kind of see it in a sense that way. How do I break down a name, or in this sense, how do I break down a question to understand what the answer is or what it does? That's how you start to understand critical thinking. Does that make sense?
Yes.
Yeah. So if that helps, kind of do it that way. Question 3 asks, which type of joint has extremely limited movement capabilities? So the punchline I would ask myself here is extremely limited. That's it.
That's synarthrotic.
Okay, Amanda says synarthrotic.
I would go with that one as well.
Synarthrotic? Okay.
Mhm.
Final answer?
Yes.
Okay. This one doesn't have a correct answer. I'll blame Victor for that one. Yes, but it's synarthrotic.
Ese sí me lo aprendí porque me lo aprendí en español.
Sin movimiento.
Sin movimiento.
Sin movimiento.
Yep, good. So diathrotic allows for
Free. They're free
movement.
moving.
So in this sense, you have two answers that mean two things, right? So you could probably, if you didn't know this question, you could probably go with the answers and be like, well, you can't have two right answers, right? Because diathrodic would be ball and socket. So you would have to eliminate yourself with like, okay, well, I'm only stuck with synarthrotic or synovial. Right? So, but that being said, extremely limited is synarthrotic. So good job. Okay, question 4. What is the what is the dense fibrous sheath that surrounds the diaphysis? So diaphysis, what is diaphysis? Remember A&P, diaphysis?
Diaphysis isn't the ends of the bone? Because I know it's that or it's the length, right?
So we're talking about the bone, definitely. Mm-hmm. Mauri?
I think the sheet that would surround it was the articular cartilage.
Yeah.
Okay, so the diaphysis, if we remember the diaphysis, the anatomy of a bone is going to be that shaft, right? That's that main, it's that midsection of the whole bone. Okay. So your answer is going to be articular cartilage and Yamada?
Yes, articular
Okay.
cartilage.
Okay. No, it's the periosteum. So we're talking about what surrounds the diaphysis, what is going around the bone. Remember, layers, every bone has a layer, right? Every tissue has this particular layer. So in this case of the shaft of the bone, we're talking about the periosteum. Okay.
So
The articular cartilage is the where the cartilage goes above. So the actual ends of the shaft, the actual ends of the bone. Okay. Diaphysis, obviously, that's not even an answer because it's asking what is surrounding the diaphysis, right?
Mm.
So that's question A. Answer A is going to be out of the question. Articular cartilage, where are you going to find cartilage? Are you going to find it in the middle of the bone?
Well, you just mentioned that it was at the ends.
Right. So you're going to only find them at the ends. Synovial membrane, that wouldn't make sense because not all of our bones have a synovial area. So your only answer that would make sense would be the periosteum. So narrowing it down to, again, like how I mentioned, 2 possible answer choices is going to be your best bet. And asking your question, well, does that make sense? So in this case, diaphysis is out, articular cartilage. I would even imagine if I was guessing on this question, that's going to be at the edge. I'm most of the time see cartilage between joints, not in the center or around them. And then the synovial membrane wouldn't even make sense as far as, well, not all bones are synovial joints. So periosteum would be the best answer. Any questions?
No, I'm just gonna need a lot of studying.
Okay,
A lot.
no problem. That's okay. That's why we're doing this. All right, so what is the principal neurotransmitter involved in muscle contraction? So what is the question asking? I know it's asking neurotransmitter, break it down to like 2 to 3 words max. Okay, what am I being asked? I'm asking about a neurotransmitter involved in muscle contraction. Because what did I say in kinase? You can't have a contraction without a nerve innervation. Muscles, if the brain doesn't tell your body what to do, right? There's no nerve signal being sent out. Like me doing this is my brain telling me, okay, fling your hands up, right? That's causing my arms to move, okay? But in order to do that, there's a specific neurotransmitter that gives that signal. And what is it? Is it acetylcholine, glutamate, serotonin, adenosine? Where have you heard adenosine? ATP, right? Adenosine triphosphate.
It's energy.
Energy. Yeah. Serotonin, glutamate, acetylcholine. Do any of those ring a bell?
Right now, I would just
No?
say serotonin or acetylcholine.
Okay. Mauri says acetylcholine and serotonin.
I am between the first one and the last one, which is, and but I don't think it's an.
Okay, so we're going to go with the first one and serotonin and adenosine. Okay, so you're telling me that, yeah, glutamate it doesn't make sense. So
No.
we're going to go, correct choice is acetylcholine. If you go back to your, to the presentation I gave on the nervous system, you know how I broke it down into like muscular, nervous system, and then why those two are important together. You'll know that when the brain sends a signal at the synapses of a nerve cell, one neurotransmitter as far as acetylcholine, along with a lot of different ions. You have sodium, you have potassium, you have calcium, right? If this is ringing a bell, you need acetylcholine to release that signal into the muscle to contract it. And then there's going to be a reuptake of calcium. And then it kind of goes into the whole sliding filament theory. But if you go back into that section, it'll say that the principal neurotransmitter involved in muscle contraction will be acetylcholine. Glutamate has nothing to do with that. It is a neurotransmitter. However, it's more it functions more for like brain. It's for like memory. So that really, it really has nothing to do with muscle contraction. Serotonin, yes, is a neurotransmitter. However, that's like if you think of dopamine and serotonin, one makes you kind of happy, it gives you more of an up, whereas the other one gives you kind of a calm and comes down. And adenosine is part of like the adenosine triphosphate molecule, which is more used for energy. Okay, so the correct answer you will go with would be acetylcholine. Okay, so kind of review that when it comes to going back to talking about the nervous system and muscle contractions and kines.
I think that one it's kind of hard because within the muscle contraction, I remember talking on regards to the dopamine, which would
I'm
help.
sorry, you remember what? Sorry, you broke out a little bit.
Yeah, for that one, I was having a hard time because for the muscle contraction, I remember like going through dopamine, which was to help regulate blood pressure
For
and
sure. Mm-hmm.
all that. So that's why I was like, okay, you do need dopamine and serotonin, because within that area. So I don't know. It's just
You do need it. I'm not saying you don't. There's specific so think of neurotransmitters as different roles, right? What is the brain asking my body? And obviously, thank God we don't have to do this, right? We don't have to do this on our. Imagine if we had to be like, all right, body, lift your finger and we have to send this neurotransmitter. Can you put you might know like it's amazing what our body does. So yes, every type of neurotransmitter has a specific role, whether it's regulating mood, whether it's regulating hormones, whether it's regulating blood pressure, everything has a specific role. But breaking down the question, what is it specifically asking me? It has to do with muscle contraction. And that goes for any type of, blinking of the eye. That goes for kicking a ball with our leg. That goes for just even sitting up, standing up from a sitting position, things like that. So I know it seems daunting, but really, really read the question as what is it specifically asking me? Okay. Number 6 asks, what is the basic unit of contraction in a muscle cell? Is it A, fascicle, B, retinacula, C, sarcomere, D, perimysium? Okay, what is it asking? Break down the question. What is it asking? We're definitely talking about the muscle cell. And where does contraction occur? Was it the fascicle?
either sarcomere, like
Okay, Maori says sarcomere. Yeah, I can hear you.
The perimysium.
Oh, okay. So Maori says sarcomere. Yeah, Mata says perimysium. Okay. The right answer is sarcomere. So the perimysium and the fascicles, we're gonna leave that to layers. So fascicle, you're gonna find perimysium, and you're gonna find fascicle as far as layers go in the muscle. Remember, I referred to like the muscle. If you took it down into layers, it reminded me of a Twizzler. Now when you buy like big bunch of Twizzlers and then you kind of like you're able to peel them off.
Mm-hmm.
Each one of those would begin. So the perimysium is going to be the more external layer of the muscle tissue, whereas the fascicle you're kind of getting more in depth internally. Okay, the retinacula is going to be more pertaining to connective tissue. So retinaculum, like in the thoracolumbar So that little spot, that diamond at the small of your back, that's a retinacula, thoracic columbar retinaculum. It's what connects fascially muscles to other parts of the hip, the muscles of the glutes. So think of retinaculum more connective tissue. But breaking this question down, it's specifically asking where does contraction happen in a muscle cell? So Mauri is correct, sarcomere. Questions? Okay. Question 7. What helps regulate body temperature and eliminate waste?
That would be the, I would say it's the pseudo-reflux glands.
Okay. Mara?
Yeah, that should be like the sweat glands. So
Mhm.
yeah, pseudo feed whatever gland.
Pseudoiferous. If because I, most of us are bilingual, I like to think of this as sudor, right? Sudor is sweat. So to regulate body temperature, when we overheat, our body naturally does what to cool us down?
Sweat.
Sweat. Okay. And then because the skin is so porous, it
Lets
helps us
out water.
detox, going
Yeah.
to eliminate waste. So in the form of water, right? Um, so if that was your first thought, you'd go with that one, or would you have like another 50-50?
No, that one.
No, that's
Okay. So the answer correct is sudoriferous. Okay, sudor. I remember doing that. Like sudor sounds like sweat in Spanish. So that's a good one. Sebaceous glands are your oil glands. Okay. They don't really regulate temperatures or eliminate waste other than oil, but that's basically all you're looking at. They are found also in the skin, but in this case, those are going to be more oil. Salivary glands, well, obviously we'll find them in the mouth, right, around our tongue. And then endocrine glands, those, I mean, yeah, it says glands, but endocrine glands are really related more to specifically hormones. Okay, so if the question's specifically asking right off the bat, it would have been like, okay, body temperature and what eliminates waste. So good job. Oops. Question 8. What is the term used to describe the neuron while resting and not conducting an impulse?
Depolarization.
Mauri said repolarization.
No, depolarization.
depolarization.
Okay. For both of you?
Mhm.
Final answer?
Give me a pillow.
Monday?
Yes. Yes, final answer. No, sorry, I was asking for a pillow. Sorry.
Oh, okay, okay. Yes, the correct answer is depolarization. Right? Because it's not conducting an impulse.
Mhm.
Good. Question 9. Which of the following neurotransmitters is mostly excitatory? So it's already stating, okay, these are all neurotransmitters. This is not a trick question. These are all neurotransmitters. Which of the following neurotransmitters? Okay, cool. But which one of these is most excitatory?
I would say endorphins,
Okay.
just because I know that makes you happy.
Yeah.
Okay, Legally Blonde. No te creas. Mauri?
I mean, I would also go with that one because it is one that makes you happy, like Mara says. And then obviously it wouldn't be the serotonin because we were talking about dopamine and serotonin right now. So I would go with endorphins as well.
Okay, endorphins.
No.
Histamine.
Mm.
I thought histamines are. Isn't that when you get like allergic reactions?
Allergic reaction or inflammatory?
Mm-hmm.
So how's that happy?
Because, I mean, histamine is going to create an immune response. So endorphins, yeah, they're going to make you happy, but what is going to kickstart your immune response as far as something that's potentially being I want to say life threatening, but it's being threatening to your body. So whenever there's a reaction, typically your body is going to respond with some type of histamine neurotransmitter. And then it's going to excite everything else, because now if you're in stress mode, what else is going to be elevated? Let's think
Cortisol.
stress. You're going to endorse cortisol levels to go up. And now you're going to be in what type of system?
The fight or flight.
Yeah. So that being said, histamines are going to be your most excitatory. Yeah, endorphins will make you happy. You know, they'll give you an up. It's just really a mood elevation, but not necessarily as like, okay, I'm in fire fight mode.
Reaction.
You're not in reacting mode. Mm-hmm. Does that make sense, Modi?
Yeah.
So anything we do, always think that we're either, especially in this industry, what is our ultimate goal? Yeah, we're going to most people are stressed out, so we have to find a way, an avenue to help them calm their nervous system. So we're always constantly fighting that battle, because why do people come for us or come to us, right? It's because there's a constant stress um, being used. So in this sense, excitatory is histamine. Okay. Question 10, what portion of the brain controls secretions of the anterior pituitary through hormones and controls secretions of the posterior pituitary through nerve impulses?
It says correct
This
on
has to do
hypothalamus.
this has to do with the brain.
I think it's giving us the answer. Doesn't it say correct under hypothalamus?
It's anterior.
So the question's actually like giving you the answer, because it's saying the portion of the brain controls secretions of the anterior, and then it's on there. Okay.
I saw that too, and I was like, wait a minute, what?
Yeah, it's weird.
I didn't do these questions, guys. Look at us. Yeah, the hypothalamus. I would say this is a typo.
Because it says what portion, not what section of the brain.
And the hypothalamus does control. It controls a lot, actually. Yeah, it does control hormones, and it does control nerve impulses. That's funny. I'm gonna have a laugh with that one.
The correct answer would be anterior.
No, it's hypothalamus.
Oh.
When I clicked it, I was like, why is it coming out anterior?
Oh, so the right answer is hypothalamus.
Yeah.
That's why I was like, wait, so that okay. Can't do that to me.
Yeah, I tell you that it's
Oh, that's why I was like,
I
so
mean,
the answer is telling, like the question's telling you the answer. That's why I asked you. I was like, wait, what?
No, because I mean it says portion, not what sections. I don't know.
I've had a long day, guys. Sorry.
Yeah,
Uh,
I have to. It's
it's
okay. Moving on. What gland secretes melatonin? And what is melatonin? What does melatonin do?
Called
What do we know of
sleepies.
melatonin? Right. Okay.
oh my God, I remember this question. Oh, I'm gonna go with parathyroid. Uh,
Okay. Parathyroid.
wait, oh man. Because I'm between parathyroid and pituitary, but just off of remembering seeing this question before.
So melatonin is your natural sleep hormone, right? It's what kind of really, really drives you down, really brings you into like REM, really chills you out. So that's like a natural sleep hormone. So we got okay, so Maudie's 50-50 is parathyroid and pituitary. Mara?
I want to say it's parathyroid also.
Okay.
Yeah, because if it's like it secretes the sleepy.
Where are we gonna find melatonin you really?
So it's supposed to be in your brain? Oh,
Mhm.
Yeah, because pituitary would be around our brain.
It's what so
Pituitary
melatonin,
gland.
what do we know about melatonin? Okay, sleep. If we don't have enough of it, it kind of messes with our internal clock, right? That's kind of why sometimes our circadian rhythms get kind of off. Like,
I think
what is
it's
our internal clock? So if we're thinking, okay, parathyroid, we're thinking pituitary. If you
I
can
think I would
eliminate
say
one or the other,
pineal because parathyroid would be around our thyroid, which has nothing to do with our throat. That would be something else. Pituitary would be in our brain.
in our brain. So
Mhm.
then it's
Well,
it
and then
has to be
testes
into.
obviously not. So I would say pineal.
You
Yeah.
wouldn't think testes?
No.
No. Okay.
So yeah, I mean pineal or pituitary for sure, but
Okay. Okay. So now you're shifting now because you're thinking critically, right? Now you're shifting. So pineal and pituitary. Take a 50-50.
I would say
Go.
pineal.
Okay. We got one pineal.
the 50-50.
Mhm. Yep. Just pick one. Go. This would be if this was a question for you, be like, I'm just gonna pick one and go. What would it be?
I'll do the opposite. Pituitary.
Okay. It's pineal. So great job breaking down parathyroid, Mari. Yeah, parathyroid is beneath thyroid, which has nothing to do with sleep,
Yeah.
right? Thyroid has to do basically more with your
Digestion.
different type of hormones regulating to metabolism.
Mhm.
Testing, I mean, that's out of the question. That's more um, on the male side. Pituitary is more of a hormone for growth development. So that's more on the side of HGH, growth hormone,
Mhm.
metabolism, things of that sort. Whereas pineal that's where that secretion of melatonin is going to come in for that natural sleep, that internal clock, that circadian rhythm, right? When we don't have enough of it, we don't get a good rhythm of sleep. So, good job, buddy. Any questions?
No.
I want you guys to kind of learn, decipher the question, really understand what it's asking you, and then ask yourself questions. It's okay to ask yourself questions. In the test, like when I remember when I was taking the test, I remember they gave us paper and a pencil. And I always ask myself, all right, 50-50, give my 50-50 answers and then break down those answers of why. I know we have a time limit, but it's a really good critical thinking exercise to do while you're test taking. So since you broke it down to pineal and pituitary, okay, I'm gonna do my best guess. I really don't know it, but if you start asking yourself questions like, "Oh, parathyroid doesn't absolutely make sense," even though that was my first choice, right? Now you started to shift because you started asking things that you may have remembered, and it started making sense. So, question 12: what are the cells within testes that produce testosterone? So now we're talking about testes, and we're talking about testosterone.
That one I would say the ductus deferens, because it is within the ejaculatory duct, and it's asking
Okay,
what produces testosterone.
but it's right. It's asking what produces testosterone. So we have one ductus deferens. If you guys will excuse me real quick, I'll be right back. Okay, give me 1 second.
Are these within the study guide that we received online?
No.
No.
Mm-mm.
Mm.
No, though a lot of the questions he put was a lot of true and false.
Oh,
Okay, what did we decide? So I had ductus deferens, and then what else?
I would say the same thing.
Final answer?
Yeah.
The answer is interstitial cells of Leydig. Do we understand why? Did it come back or no?
mm.
So the ductus deferens is more of a since you went with that answer, Mari, the ductus deferens is more of transport. It's an area of transport. It's not necessarily where testosterone is produced. Um, whereas the actual production of testosterone would be in the cells alone. Luteum is a phase, like we as females, we have our luteal phases when we go through our menstrual cycle. And then as far as Cowper glands, we're thinking more of it's more of where other hormones and accessory glands in many male reproductive systems happen. and that's also found, I believe, in females as well. And hormones, lutein is a luteinizing hormone. So that's another type of hormone that's responsible for creating something else. But in this case, it's only asking for the production of testosterone. Okay, so but I would have gone, if this was my first guess and I'm just kind of understanding like what am I being asked, my first answer would have been ductus deferens. But ductus deferens is just really just a portion of the male reproductive used for transport. It really doesn't create or produce anything. Question 13, what term describes the superior chambers of the heart? And we have superior and we have inferior, right? So if we have superior, we're going to have inferior. But what are the superior portions of the heart named or called? Fifty-50. Break down the answer choices right off the bat. What would make sense? 50-50. I'm talking about chambers. Okay, cool.
So
it's a right chamber, left chamber.
It's either the ventricles or atria, but I'm trying to remember which one goes on top and which one goes on bottom. I know those are the right, but
yeah,
especially because I'm dyslexic, so I switch them.
Okay. Okay, so you eliminated 2 out of the 4. Cool. Now, what's next? What would you go with?
I think the aorta.
What does your heart say? I'm just kidding.
I'm gonna go with ventricles. I think there was a way that I remembered this for that same reason, because I was like, I'm gonna yeah, I want to say ventricles.
Okay, we got 1 ventricles.
I can't remember.
I would say an aorta because the ventricles is within the chambers. Like I said, there's a right ventricle and a left ventricle within the. I would just go with the aorta because that's the one that's at top that has little attachment, the valve.
Okay, so we got ventricles and we got aorta. Yes?
Yeah, aorta.
Okay.
Is it saying
it's atria.
It is a.
Oh, what?
It's atria. So you have your atrium and your ventricle, but plurally, it's atria and ventricles. So, Mara, you were in the right direction as far as like, okay, I remember ventricles and atria, can't remember which one. The question is asking chambers of the heart.
Yeah,
and it's specifically superior. So when I think superior, I think of where's superior?
in the top.
Above, right? So one way that you can remember is arriba begins with A. Superior, arriba, atria.
Yeah.
Ventricles will be at the bottom. So inferior chambers will be your ventricles.
Your ventricles.
You have a systematic thing that happens, right? The aorta is the actual main artery.
Yeah. Right?
Not necessarily yes, it's part of the heart, but it's a main artery of the heart. So
yeah, and it's not the chamber.
It doesn't have to do with chambers.
Mm.
So we have this whole system, right, where blood flows in from the lungs, goes into the heart, comes in from the atria down to the ventricle, goes up, right? It does this whole thing, circular thing in and out of the system. But pericardium wouldn't even make sense because that is more
on the outside.
Mm-hmm. Right. So that's the surrounding external layer of the heart. So that doesn't really have anything to do with chambers. Aorta would be the main artery, and atria would be the superior chamber of the heart.
Yeah.
Okay. Oh, okay. 14. What term describes the duct that drains lymph from the right arm, right side of the head, and right half of the thorax into the right subclavian vein. A, thoracic duct. B, left lymphatic duct. C, right lymphatic duct. D, aortic duct. Eliminate. Give me two answer choices. Go.
I don't know, I guess it's also in the question. It says, what term describes the duct that drains lymph from the right arm? So I will go with the right lymphatic duct.
Okay. Mara?
Yeah, but I think if I'm not mistaken, this is like one giant, like all the right side, and then it's just a small part
So you think
that
it's a
drains the left.
two-part?
So it's yeah, I'm like I want to say it's the aortic duct.
Right
Oh,
lymphatic duct. Mari was correct.
yeah, because that one is the one that I'm telling. Isn't it like most of it gets drained on one, and then it's like the left side is just very, very small.
Yeah, but for the most part, because it's basically just reading and understanding like what is it asking me. So in this sense, like this is one in a million questions that has the answer right in the actual question.
Yeah, makes sense.
Yeah. Okay. 15. What is the main muscle of respiration?
The diaphragm.
Okay, I have a diaphragm. Okay, if you read this question differently, you can't breathe without this one muscle, basically.
No, I would probably go with pectoralis minor because it wouldn't be the nasal cavity or the trachea, but because the diaphragm is just what's separating, like the muscle that's separating. Um,
Okay, so it's not asking organ, right? So you're taking stuff out, right?
which main muscle of respiration? I would still go with pectoralis minor.
Okay. I have a diaphragm, pectoralis minor. Final answers?
Mm-hmm.
It's diaphragm.
Mm-hmm.
So yeah, you're right, Moni. I like how you kind of distinguish like, well, it's more of a separation. It's kind of like a curtain, right? It divides a particular body cavity. In this case, though, you can't have respiration because the diaphragm has to be able to pull to increase the volume of oxygen in your lungs.
Okay.
So think of it that way. Pectoralis minor, I see where you're kind of seeing it because you know when you breathe, yeah, it's involved, but really what's happening is because of where they're actually connected, pectoralis minor comes from your bones here down to the first 3 to 4 rib cages
Uh-huh.
bones, but as you breathe, they expand, but it's not the main muscle of respiration. So there's a difference within what is involved along with this, but without this happening, the diaphragm is what pulls down to create increased volume of oxygen.
Oh,
So think of
okay.
it that way. So it's not necessarily just a divider between cavities. It functions as the main role in breathing. Right? So when you belly breathe, you know, you expand, right? You inhale, what happens to your belly? It comes out, right? It widens. But that can't happen without the diaphragm.
Okay.
16 asks, what term describes the process by which molecules from the digestive tract moves into the bloodstreams or lymph vessels and then into the cells? Is it A, secretion, B, absorption, C, digestion, D, ingestion?
I would say absorption.
Absorption,
Okay.
because absorbs.
Okay. Final answers?
Mhm.
That is correct. Good. 17. What is the area within the kidney that monitors blood pressure? A, Bowman capsule. B, I can never say this one. Juxtaglomerular apparatus. C, glomerulus. D, loop of Henle.
Say Bowman capsule.
That's a tongue twister.
Mm.
Sure, let's go with the brown man capsule. Bowman capsule.
Bowman capsule. Okay, I'm gonna go with Bowman capsule. The correct answer is juxtaglomerular apparatus. That one's gonna have to be a review on the excretory. That's gonna be in the kidney. So if we go back into the anatomy of it, right? I'm gonna be honest, it's been a while, but the Bowman's capsule. Let's pull it up. Kitty.
That one's like literally
I think
outside
that
of the
one's
glomerulus.
isn't that what in your urinary or something?
Well, it's the anatomy of the actual kidney. No, these are all parts of the kidney. So watch, let me show you. No, I'm not talking about the bladder. I'm talking about the actual nephron. Okay, so look. If we were to take the kidney cell, right, this would be the kidney. It's that little bean, right? But if we go into even more detail of the actual kidney cell, this is what we're looking at, which is right here to my right. So there's a lot happening within these sections, these little areas of the kidney. And then it gets broken down into like this right here. This is what's known as the Bowman's capsule. This is the glomerulus. This is where the filtration is actually happening. And then you have like all of these the yellow parts, which are known as tubules. Okay, that's kind of what ends up being excreted to be even going down into the ureter, down into the bladder. So there's a lot happening when it comes to the kidney and blood pressure regulation. We think that it's mostly cardiovascular, but we don't take into consideration the filtration process that our kidneys go through. They're in very high demand because what is the responsibility of the kidney?
Excrete water.
It's to filtrate. It's to filtrate. There's a lot of detoxification that has to do with the liver and the kidneys together. That being said, if there's an abnormality or an irregularity of volume in water, our kidneys become distressed, and there's no excretion. So when it comes to the actual area that monitors blood pressure, it's going to be the juxtaglomerular apparatus. So you can review that as far as anatomy goes. But yeah, there's a lot when it comes to detoxification. That's why people, like, when they don't take care of themselves, you see people, especially with diabetes, they have a lot of issues, right, with their kidneys. A lot of them, when they go into like further stages of renal failure, that's because they're not regulating sugar levels, right? But then two, they're not their filtration system is completely out of whack. There's such a high volume of, like, especially sugar levels in the body, that the body has to, like, okay, how do we get rid of all this excess sugar? And then it just becomes such a stressor for the kidney that it eventually starts to fail, right? So and I know that's a topic for another day, but you get to learn and understand, like, when you really talk about stress, you're really talking about all of the things that are involved. So any questions as far as A&P goes? I know that's like only 17 questions, but it seems that there's going to have to be a lot of review.
Yeah.
So that's 17% of the test. All right, section 3 out of 9, which it's really talking about pathology. This is 9% of the MBLEX. Which pathology is loss of normal bone density and increased susceptibility to fractures?
Osteoporosis.
Oh, she went right through that one. Okay, cool. We got osteoporosis. Osteoporosis?
Yes.
All right. Good. Correct answer is osteoporosis. What gave it away?
Arthritis is inflammation, and it's saying bone, loss of bone density.
Mm-hmm. Yes. And you're more susceptible. Most people with osteoporosis are more susceptible to fractures. So good. Which condition is characterized by localized areas of tender points, widespread pain, joint stiffness, and fatigue, with the affected person having no symptoms of inflammations or degeneration in the tissues? A, fibromyalgia syndrome, B, Osgood-Schlatter disease, C, de Quervain tenosynovitis, D, myofascial pain syndrome.
With fibromyalgia syndrome.
Okay, fibromyalgia. What else?
I would say fibromyalgia as well.
Fibro. Okay, let's go with fibro. Correct. Good job. Which condition causes accelerated proliferation of epidermal cells? Epidermal cells leading to the buildup of thick skin and patches. A, eczema, B, shingles, C, impetigo, D, psoriasis.
Say eczema.
Eczema.
Eczema?
Eczema.
Okay. That's your go-to punch? No questions asked. Okay. It's psoriasis.
They both have patches.
Mm-hmm. Why did you go with eczema?
Because it also leads the skin to getting patched up.
Yeah, I mean, it can appear as, patchy, the skin is inflamed, it's irritated. Shingles is more of a neurological thing happening. So it's not, I mean, yeah, it does have to do with skin, but it's not really having to do with anything patches go.
It's just like the color pigmentation.
Yeah, so in Pedigo, when I had read this question a long time ago, I thought the same thing. For some odd reason I went with impetigo because I was thinking patches, like the different color pigmentation. But in this case, psoriasis is the correct answer.
And then with psoriasis, I guess I like related into it being the inflammatory skin condition. So I don't know how. I mean,
Think of eczema more as more of a rash.
Mm-hmm.
It's not necessarily like an increased buildup of thick skin. When I think of thick skin, I think of more of like calluses. Whereas eczema would be more of like it's irritated, it's inflamed, it becomes more of a rash than actual buildup of skin.
Mm.
Whereas that's what psoriasis is. Okay. Any questions? Any confusion?
No.
21, which condition is caused by compression of nerves in the brachial plexus? A, sciatica, B, Bell's palsy, C, thoracic outlet syndrome, D, trigeminal neuralgia.
Trigeminal neuralgia.
Yeah.
Okay, trigeminal neuralgia. Final answer?
Mm-hmm.
It's thoracic outlet syndrome. So sciatica and Bell's palsy, we're not going to probably feel it, or yeah, where's sciatica going to be mostly involved?
In your back, in your leg,
Okay, Bell's palsy.
your face.
Okay. Why do you say trigeminal neuralgia?
Because it's also part of a tri-branch, like in your face.
Okay, but it's asking brachial plexus.
Brachial.
So where do we understand brachial plexus being?
It's on your. Sorry. Yeah.
That'll be your
Yeah. So trigeminal will be here. You have your three main nerves, trigeminal. So if you think of three, put your hand right here above your eyelid or above your eyebrow, above your arch here, and then right down to your jawline. That's going to be trigeminal neuralgia. So this is going to be more of a facial issue of nerve pain, whereas thoracic outlet syndrome is going to be dealing with the brachial plexus, because we're brachial. The only part I'm going to see brachial in the human body will be my arm. So if there's a compression of nerves coming down, running down underneath, especially our pec minor, that's where most of those nerves get compressed, because just of that section of where they connect from our coronoid process to our rib cage. So that being said, it runs underneath and down into our armpit and then down into our arm. So right off the bat, I would have thought brachial. I'm thinking of arm. These have nothing to do with the arm.
Yeah.
Mm-hmm.
I just went for neuralgia because of the nerves.
Mm-hmm.
Nerve, yeah.
Yeah.
22, which condition is caused by an underactive thyroid gland leading to thyroid hormone deficiency? Is that A, diabetes mellitus, B, goiter, C, lupus, D, Hashimoto's disease? What is the question asking?
Underactive thyroid gland.
Okay, where do you put that as far as the answer choices go?
Well, lupus is a deficiency, and it's when kind of like an autoimmune.
Okay.
I wouldn't say that would be.
I would say Hashimoto disease.
Yeah.
Final answer?
Diabetes mellitus wouldn't be one either.
So we're going with Hashimoto?
Yeah.
Okay. That's correct. Now the question I would probably ask you, what is an overactive thyroid gland called?
Overact.
I'm sorry? If hypo means below, so Hashimoto is also known as hypothyroidism. Hyperthyroidism is known as Graves.
As what?
As Graves disease. So you have an overactive. That's why you'll see people who are very, very thin, but they have thyroid problems because it's so active that they have a higher metabolism. So Graves disease is hyperthyroidism, whereas Hashimoto's is hypothyroidism. That's where you see the people who have a very, very low metabolism. They gain weight and they have to adjust their thyroid levels. They have like those bulging eyes. So underactive is Hashimoto's, whereas hyperactive is Graves. Just remember that. 23, which condition is characterized by periodic episodes of vasospasm in the fingers and toes? Raynaud disease, deep vein thrombosis, myocardial infarction, congestive heart failure.
Raynaud
I mean,
disease.
we could take away the last two.
Okay, cool. So then now you're stuck with Raynaud and deep vein thrombosis. So if you had to pick between those two, what would it go with?
Well, I know Raynaud's when your fingers are cold. Like, so you lose sensation on your
Okay.
fingers and toes. But I don't know
Okay.
if it's spasms.
What do we know? Okay, you eliminated the other two, cool. But what do we know about now deep vein thrombosis? Where is it mostly? What's the most common area you'll find DVT? Where have you heard DVT most commonly seen?
Your legs? I
Mm-hmm.
don't know.
Yeah. So because the question is asking in the fingers and toes, I've already eliminated 50% of the answer choices, but deep vein thrombosis is coming out at me like, no, that's going to be mostly found in the legs. So I'm going to go with Raynaud disease. And that is the correct answer. It's rare you'll find deep vein thrombosis in any other part of the body, such as the arms, the hands, upper body. But most of the common time, you'll find in the lower extremities. So that's how you eliminated that one. So good job. 24. Which condition is a chronic autoimmune inflammatory disease of the body's connective tissues? A. Allergies. B. Chronic fatigue syndrome. C. Systemic lupus erythematosus. D. Acquired immunodeficiency syndrome.
I mean, it does have autoimmune and chronic, which lupus does carry that.
So you're gravitating to that, right?
It's more into like a.
So for sure it's the last two. You're breaking it down.
Cool. Last two. Now, what would you go with?
I would say acquired immunodeficiency syndrome.
You're gonna go Maori with lupus still, or are you gonna change your answer?
No, I think I'll go with systemic lupus erythematosus.
Okay, cool. Let's go with acquired immunodeficiency syndrome. Correct answer is systemic lupus. Acquired immunodeficiency syndrome is also known as what? AIDS.
Yeah.
Acquired immunodeficiency syndrome, AIDS. Okay, so even then, yes, even though it's a type of immune disease, it's an inflammatory disease. Yes, it's more with the blood system. What's it called? Sexually transmitted diseases. So in this case, having to deal with the body's connective tissues, where that's where the lupus is going to come in. So the correct answer is lupus.
I'm so sorry. Really quick question. Are we gonna go through all the 100 questions?
That's
like?
the
Are we
plan.
gonna? I'm sorry.
I mean, we have till 8. I know it's a lot of questions, but
Well, I didn't know what time, how long we were scheduled for. I'm sorry.
till 8.
Okay.
I mean, unless we can do another run through. I don't know what Victor wants to do with that, but we can ask him. I can ask him. I know it's a lot because like whatever answers you don't get right, like I like to explain stuff.
Yeah.
But
I mean, we still have like literally like 75 or there's
Yeah, there's no way. That's why I'm like,
yeah. I don't know. I don't know how you guys feel about like just okay, read the question, go through it. Okay, next. I don't know. That's not me. We can try it, but that's why I want you guys to understand. Like, okay, get the process, read the question. What is it asking me? Eliminate. That's the best way to answer, like especially these kind of MBLEX questions, any type of multiple choice question. So, if we move on, question 25 is which condition? Again, we're still in pathology. So, which condition involves permanent enlargement of lower airways accompanied by destruction of alveolar walls?
asthma.
One thing that sticks out to me is permanent. Like that's like life changing already right there when it has to do with the lungs and destruction.
I mean, laryngitis is the throat, and then
sinuses is your.
So
Yeah.
it's none
It
of
would
those.
have to be the last. I would say the last one because the asthma, I don't think that's permanent.
No, that's not. So emphysema.
You're gonna go with emphysema? Yep, correct. Good. Now you guys got it quick. That was good. Okay, which condition involves damaged areas of the gastrointestinal mucosa that are exposed to acidic gastric juice? What is it asking? Quick. Damage.
That's septic ulcer.
We're
We're all frequent shoppers right there.
Yeah.
Yep, correct. Good. Next section is health, hygiene, and universal precautions. This is 7% of the test. According to the American College of Sports Medicine, also known as ACSM, how often should adults participate in resistance exercises? Every day, 2 to 3 days a week, 1 day each week, every other week.
So 2 to 3 days.
Okay, good. Which wellness domain involves a commitment to lifelong learning? Emotional, intellectual, spiritual, social.
Intellectual?
Okay, got intellectual?
Yeah.
Intellectual?
Yeah.
Good. Correct. Which terms are methods of pathogen transmission? Okay. A, contact vehicle vector. B, local, intermediate, and widespread. C, stage 1, stage 2, stage 3. D, acute, subacute, and chronic.
Local.
Again, what is it asking? What is it asking? Pathogen and transmission.
I would say local, intermediate, and widespread.
Okay.
But
because it's asking what are the methods of pathogen.
Mm-hmm.
So I would say contact vehicle and vector because you're transmitting it. Like, how is it going to pass?
Right. So I have an A and I have a B. Final answers?
Yeah, for me, yeah.
I would still stick with the local, intermediate, and widespread.
Okay, let's go with local, intermediate, and widespread. Correct answer is contact, vehicle, and vector. Right. So when there's a potential pathogen transmission, what has to happen? What happened with COVID? What were people so afraid of?
Touching.
Contact. Why do we have to be 6 feet apart? Right. So in order to have some type of pathogen transmission, in order to become the host, something has to give. We have to be in contact with something that has the potential pathogen, right? This doesn't happen without contact. So yes, it's contact, vehicle, and vector. 30, which method of disease transmission is the most common? Okay, now having to break down the method, right? Is it vector, contact, vehicle, or isolation?
Contact.
Contact.
Yes, contact. We couldn't have had COVID-19 with people not touching each other. Which method is the best for infection control? All right, now we have an infection. Now what? How do we control it? What's the best method?
Hand hygiene.
Hygiene.
Supplements, receiving vaccinations, avoiding massaging clients who are ill.
Say hand hygiene.
Mm-hmm.
Hand hygiene, okay. Good. Correct. Approximately how much bleach should be added to a washing machine to disinfect contaminated linens? A, 1/4 to half a cup. B, half a cup to 1 cup. C, 1 to 1 1/4 cups. D, 1 1/4 to 1 3/4 cups.
I think that was the 1/4 to 1/2.
I have a 1/4 to 1/2, okay.
I think so too.
Incorrect. It's B, 1/2 to 1 cup.
I mean, because wouldn't that one like be like, well, I mean, it's kind of hard to tell because depending how much linen you're gonna put, because wouldn't it be like a certain ratio where it would be half?
Yeah, I guess you can use your discretion, but like on average, that's what you want to use for like most large loads, half a cup to 1 cup. Because I don't think you like do 1 to 3 sheets a day.
Yeah.
But again, this is asking like contaminated linens. So on an average, it's about half to 1 cup because you small loads. I mean, yeah, you can use your discretion as far as ratios go, but on average, people do large loads when it comes to laundry. Okay. Which terms means the source of infection? Okay, it's asking me source. Where is it coming from? Is it the host?
The host.
Is it the portal? Is it the disease? Or is it the reservoir?
I'd say the host.
Okay, I have a host.
A portal.
I have a host and a portal. Let's go with portal. Incorrect, both. The correct answer is reservoir. It has to come from something somewhere. The portal is the area through it passes. The host is who gets infected.
I thought host was like what carried the.
No, the host is the person who gets infected. So when a virus comes in, I'm hosting that virus because I'm giving it an environment to thrive. I become the host. I'm the one being feasted on. Okay. But the source of infection has to come from somewhere. So where is that somewhere? In this case, it's the reservoir. The disease is whatever is the result of the infection. Next section is hydrotherapy. That counts for 4% of the test. A general recommendation is that cold be applied for a maximum of how many minutes?
15.
A5, 7, A5, B7, C15, D20.
I know, I see 15.
15, okay. What was your answer, Mara?
I would say 5.
So cold application. I have a 5 and a 15. Let's go with 5. It's 15. Generally speaking, for therapeutic purposes, across the board, even in like PT settings, cryotherapy is applied for 15 minutes and no more. Anywhere from 10 to 15 minutes. 20 is pushing it, but it's typically on average 15. That being said, what sensation is usually felt last in a cryotherapy application? Is it A, cold, B, aching, C, burning, D, numbness?
Numbness.
Numbness.
Okay. Yes, that is correct. If you could put these in order, what would it be?
You feel cold, and then it's burning and aching.
So it's cold, burning, aching, and numb. It's C-band. I remembered it as C-band. You'll feel the burning before you feel the ache. 36. Which approach should be combined with thermotherapy to increase blood flow in muscles? A, passive movement, B, active movement, C, compression, D, vibration. So what's thermotherapy?
Heat.
Heat, yes. So what approach should be combined with heat to increase blood flow?
I think that's the passive movement.
What does passive mean?
Is it passive when the client's doing it?
No.
No, that's when you're doing it, because active would be them doing the movement.
Passive is absolutely no movement coming from the client. It's an external movement. Me, the therapist, would be moving them with, when it comes to range of motion, for example, meaning they have to be complete noodles for me to do passive motion. They can't neither resist nor move me. Active movement is when the client is doing it. So in this case, if we're combining heat, we have to combine it with something else to increase blood flow. What else increases blood flow other than heat? Compression, vibration,
Compression.
active. I have compression. I have passive. What else? Mara?
I'm between compression and vibration, actually.
Okay. Let's go with compression. The correct answer is active. When you move, you increase blood flow. And combining that with heat, that is even improved increase.
So then this is more of a, not so much of a massage related, because I mean, I went with passive because we're the ones doing the massage. So I was thinking, what do we have to include with thermotherapy to increase blood flow? Because I was thinking, okay, passive is when you're doing the work, and then active when the client is like actually like moving or doing like assisted range of motion. So the question
Yeah.
is more,
Uh-huh. Go ahead.
yeah, the question is just more inclined to what else needs to be combined with thermotherapy for blood flow then.
Yeah, because the question is asking, it's in terms of blood flow. It's not asking range of motion, is it?
No.
So I can see where you were going with that, but as far as the question goes, what specifically was it asking? It didn't ask for range of motion, it asked for blood flow. So in this case, heat and active movement is what increases that. It's what allows that blood flow through muscles, right? You can think of that like when like a sauna versus like, you know, sauna combined with the massage, right? There's going to be a lot of increased blood flow. So the correct answer in this particular question is active. My first thought would have been vibration, because typically vibration with heat, that kind of increases heat, right? But when you move along with heat, um, think of exercising in a hot day, right? So just pay attention to what is being asked. Last one of hygiene. Let's see. What temperature is the water within the hydroculator? On average, where should it be? And the recommended temperature, is it A, 136 degrees to 145 degrees Fahrenheit, B, 147 degrees to 156 degrees Fahrenheit, 158 degrees to 167 degrees Fahrenheit, or 169 to 178 degrees Fahrenheit?
I would say 158 to 167.
Okay, I have a C.
I think this one goes the highest, so I want to say 169 to 178.
Okay, let's go with D. Correct answer is 158 to 167. On average, I keep the hydroculator about 160, 165. Anything about that will really boil. You don't want to keep it too hot either. But on average, 158 to 167 is the range. All right, kines. Ooh, this is going to be a good one. 11% of the test. Okay. 38 question asks, at which joints do the proximal phalanges in the fingers articulate with the middle phalanges? We got proximal and middle phalanges. Are we talking about A, carpal metacarpal, B, metatarsal phalangeal, C, distal interphalangeal, or D, proximal interphalangeal? How do we break this question down, and how do we break down the answer choices? Quick, 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 quick. What is it asking?
And which joints do the proximal
Okay, good. So we got joints, we got phalanges.
articulate?
But particularly where? Where is it asking?
In the proximal in the middle.
No, I'm looking at fingers.
Right, the proximal phalanges.
Right, but we have phalanges in our feet too. It's already giving you a location. It's asking for fingers.
There's
so
the
you're
fingers.
already talking about hands.
Yeah, because it says phalanges in the fingers, not the toes.
Yes, yes. So given that, eliminate answer choices.
Well, the metatarsal phalangeal is not, because they're tarsals that's in your feet.
Good.
So,
Okay.
so B's not it.
Absolutely. Okay. Now what? What else do we eliminate based on the question?
Well, I would eliminate the distal one because it's asking you for proximal and middle. So you don't want to go distal because that's the furthest.
Okay, so BC out. Okay. What's left?
Carpal metacarpal and proximal interphalanges. But the I mean, the carpal metacarpal, I related with the carpal tunnel, like, um, and that one you feel it more on the distal end as well,
The distal end of what?
the hand. So it's more towards your palm.
Okay. So would you say that is an answer, or you'd eliminate that one?
I don't know, maybe proximal interphalanges. Which
Okay.
joint
So I have, sorry, Mata says proximal interphalangeal, and then Mata, you're going with D as well?
yeah, proximal interphalanges.
Okay. All right, let's go with proximal interphalangeal. That is correct. So yes, good job, Mana, because tarsals have nothing to do with your hands, right? Anything in your hands has to do with uh, carpals and metacarpals. So carpal, because that's reading to your carpals, that's your wrist, and then metacarpal is connecting from your wrist to your palm, right? Your phalanges don't even start until after your metacarpals, right? So that being said, we have three distinct joints, except for the thumb, is where you have proximal interphalangeal because it's in between uh, proximal and distal, so interphalangeal, right? That's your middle. And then thumb, you're only going to have proximal and distal.
Mhm.
So in this case, because we're not even talking about this digit, right? We're talking mainly about the fingers. Um, the question, this is an example of the answer being in the question. So it's asking where fingers, right? Um, two, it's asking proximal phalanges and middle phalanges. So proximal to middle, those are interphalangeal joints. So good job. Good job breaking it down. 39, which joint connects the axial skeleton to the lower extremity? We have A, sacroiliac, B, talocrural, C, patellofemoral, D, acetabulofemoral.
Well, I would remove the talo and the patellofemoral, and
You'd
then
eliminate which one? B and C?
talocrural, and that would
Okay.
be in the heel, and then the patellofemoral would be the knee. It says
Okay.
which is um, the axial skeleton to the lower extremities. Um, sacroiliac.
Okay, I have a sacroiliac. What do you say, Mara?
Well, I would probably say
And
D.
actually, it says the femoral as well.
So I have A and I have D. Let's go with D. Incorrect. It's sacroiliac. So remember the acetabulofemoral.
It's the
Um,
hip joint.
The femur.
well, it's where the acetabulum meets the femur, but the acetabulum is within the is the socket within the hip, right?
Mhm.
So that being said, the hip is part of the lower extremity. It's not part of the axial skeleton. So the axial skeleton is the head, your vertebrae, and the sacroiliac joint because that's where it connects to the hips to create the lower extremities. So that is a joint meeting place, but it ends at the sacroiliac bone. So the sacrum and the coccyx, that's the extent of the axial skeleton. The rest becomes the appendicular skeleton. Okay, so axial ends at the sacrum coccyx area, whereas it becomes a sacroiliac joint because now it has to connect to the hips. But the acetabulum is part of the hip that joins that connects to the femur of the leg. Does that make sense? Any questions?
No.
Mara?
No.
Yeah? Okay. 40. Which ligament connects each vertebrae and is located on the posterior aspect of the vertebral column? So what is it asking?
What's connecting the vertebra?
Yeah, it has to do with the vertebrae, right? So what do we eliminate? We got A, deltoid, B, annular, C, supraspinous, D, sacrotuberous. What do we eliminate?
The
It's
deltoid.
asking, yeah, okay. It's asking about the vertebrae, so deltoid has nothing to do with it. What else do we eliminate?
The supra, no,
Spinaeus.
because that one, don't we have it over here in the front? Supra.
No, that's above the scapula, no? Supraspinaeus is above the scapula.
No, you're thinking about the supraspinatus.
Oh.
Remember, break down the words. Supraspinous, annular, sacrotuberous. Where could you potentially find these words? Even if you didn't know them.
Above the supra, be above.
So deltoid obviously is a muscle. That's not gonna be a question. Annular has to deal with shape of the vertebrae, but it's asking ligament. Which ligament? So I don't think a shape has anything to do with ligament. So now I'm down to 2, supraspinous and sacrotuberous. Sorry, why did I do 3? Supraspinous and sacrotuberous. But supraspinous, I'm thinking spine, right? Like spinous
Yeah,
process of the vertebrae. But then sacrotuberous, what about sacro? Sacro? What does it sound like?
the sacrum.
Sacrum, right. So if I had choices, I would go with supraspinous, or sacrotuberous. And my guess would be
Supraspinous. I mean, because it's within the vertebral.
correct. Very good. So supraspinous is that ligament that connects to the base of the skull, and it goes down. It goes down into your vertebrae about C3, C4. I believe probably C7, all the way to C7. But it's a long connective tissue that connects from the base of the skull down to the spinous process of your vertebrae. 41, which vertebrae is also called the atlas? C1, C2, C5, T1.
T1.
I have an A. Did you say C1 or T1, Mara?
Sorry, give me 1 sec. I'm 1 or 2. Yeah, I'll just stick to A.
C1.
Yeah.
So,
C1?
yeah.
Okay. Correct. Uh, which muscle retracts the scapula? A, rhomboid major. B, levator scapulae. C, serratus anterior. B, pectoralis minor.
It would be the levator scapula.
Okay, how about levator scapula?
No, because that's to lift, not to retract. Never mind.
What would retract? How do you retract your scapula?
Going backwards.
Okay.
And serratus anterior would be on the sides, like
Anteriorly, right?
right.
And anatomically, pectoralis minor as well, right? Would that retract or protract? Could a pectoralis minor push you back or pull you forward?
It's forward.
Okay, so would you
So the
eliminate them?
rhomboid?
Yeah, in this case, rhomboid major would make sense because Maori said levator scapula. She's like, no, it lifts, so it wouldn't retract. And then Mata's like, well, anterior, these are more in the front, so that can't be it. So you would have to go with rhomboid major. Good. 43. Which muscle is involved in a winged scapula? Is it A, trapezius, B, rhomboids, C, pectoralis minor, D, serratus anterior? What does a winged scapula look like?
Sorry about that.
I would say serratus anterior.
Okay, I have a serratus anterior. What else?
I have no idea what a winged scapula is.
So wing scapula, if you were to see the posterior side of the body, let's take the back of my hands being the scapula, right? A wing scapula would, when you're retracted and you bring your scap back, it looks like this, right? When you pinch your back together.
Mm-hmm.
A wing scapula, if I was to take my right shoulder, it would look like this. So what is causing this motion? Typically, people with a wing scapula, they don't have proper range of motion, so you have more of a an angle happening, and so it's kind slightly protracted.
So is it? I would say serratus anterior because it's getting pulled from the front.
Okay. Are we going to go with serratus anterior?
Yes.
Correct. Yes. Trapezius would have nothing to do with it because it's going to elevate it. Rhomboids would have nothing to do with it because it would do its job of bringing the scapula together, right? So if I let me take off my shirt. Right? Bringing my shoulders together. Can you guys see me?
Mm-hmm.
Yeah.
Okay, I'm retracted, right? I'm using rhomboids to bring my shoulders together closer to the spine, whereas this would be a winged. If someone didn't have proper range of motion, this is what it would look like.
Mm.
So there's a lot of, just by doing this motion, if you guys can bring your arm forward, doing this, you would feel serratus anterior contracting. And people just have this muscle is so active, so overactive that everything else becomes weak, and then this is how it looks like. So yes, there's elevation, some elevation, but that's not the primary muscle involved in a winged scapula. So the correct answer is serratus. Whoops, sorry.
Ladies, I'm sorry. I have to go. I have to eat dinner and I have to go to bed. I work at 7 o'clock in the morning tomorrow, so
Sounds
is
good.
there?
No. I understand. I can ask Victor if you guys want to continue this or if you guys want to just